Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McRae.
Tracy, I think it's fair to say that all the physicians at the Mayo Clinic are well educated and well qualified in their field of medicine. But you know, there are a few who are not only good doctors, but they're also talented in other ways.
Lots of other ways.
Yeah.
One of those is forensic pathologist, also known as medical examiner, Dr. Reade Quinton, the pride of Wiley, Texas. He has two passions, medicine and magic, and here to tell us about his day job and his avocation. Maybe just all the way around, and explain that Wiley, Texas thing. Dr. Quinton, welcome to the program.
Thank you so much for having me here. I really appreciate it.
Are you from Wiley, Texas?
No, actually, from New Orleans, Louisiana, which might explain a little bit of the magic thing too. But I've been living the last 19 years in Dallas, Texas, and Wiley is one of the cities within Dallas County.
Gotcha.
So you have not been in Rochester that long?
Oh, no. I got orientation here at Mayo during the polar vortex in January.
Oh.
So, yeah, when I looked down...
You came at the wrong time.
Yeah, when I looked down and saw an 80-degree difference between here and Dallas, I thought, oh, no.
What have I done?
Might have been a mistake.
Actually, the fact that that's when you started here in Rochester, that's good, because it won't get worse than that. I promise.
Yeah,
I hope.
you're right. But before you left, the mayor of Wiley, Texas, did proclaim Dr. Reade Quinton Day. Now, what's that about?
Oh, it's a little embarrassing, but well, when I was there were two things that I was affiliated with Wiley and some of the other surrounding cities too. But one was my work in forensic pathology. So I was the Dallas County medical examiner, the deputy chief at the time, and we did serve Wiley. So there were a number of times that I had to serve the community there in that aspect. But also there were several times in my pursuit of my passion, which is magic and sleight of hand, there were times that I was able to help Wiley in different ways, particularly when they had a few Halloween events that centered around magic and that type of thing. So anyway, I've performed magic in Wiley, but I've also done service work for Wiley too.
They must have liked you.
I guess.
I guess so.
How did you get interested in forensic pathology?
That's an easier question to answer. My father was a New Orleans police officer, and so he would come home and talk about work. And as most police officers do, he came home and said, "Son, when you grow up, you can be anything you want, but do not become a police officer." So he discouraged me from that. And so I ended up on this career path, originally being involved more in forensic science. So I originally kind of was thinking more along the lines of DNA because that was becoming the big thing at the time.
Sure.
And then eventually, thankfully, had a mentor in college who pushed me to go to medical school. And so here I am.
So forensic pathology, medical examiner, it means that you figure out why people die.
Right. So our number one job, if you will, as a medical examiner or a forensic pathologist is usually to establish cause and manner of death, so why someone died, and that's in a medical legal setting. We also have a number of other jobs. For instance, oftentimes it's identification. So we have bodies that we receive that may not be identified, and we have to figure out who they are. Sometimes that's actually more difficult than figuring out why they died.
Really?
And then on top of that, oftentimes one of my job descriptions is presentation. So basically going to court, going to a jury, and explaining to lay people what it is we do and what is so important about that in this particular case that they are there for.
The DNA aspect of that is a big deal. I mean, not just the law and order angle, like we need to wrap this up in 40 minutes.
Right.
But that, like you said, for a generation before you, that's probably wasn't even on their docket of what they considered.
Correct, yes. And even during all of my time in school and in practice, it has changed so dramatically. Some of the things that we do now that are routine collection of DNA evidence wasn't even thought of when I was going through residency and fellowship.
All right, let's talk about magic.
All right.
Okay, so we know if you grew up in New Orleans, that's
Yes.
a little bit why you're interested in magic, but you've continued that as a hobby into your adult years.
I have, and I'm one of the unusual, well, I guess all magicians are unusual in some way, but I'm one of the unusual ones in that most magicians have almost the exact same story, which is around 8 years old, I had an uncle or someone who gave me my first magic set, and then oftentimes they'll say, that's when I got the magic bug, and it just stuck with them ever since as a hobby. For me, I didn't get the, quote, magic bug until medical school, of all things. And I was actually a third-year medical student rotating through cardiothoracic surgery, and there was a physician, a retired surgeon named Dr. Watts Webb, who would come in and do small group lectures for us and talk about, today we're going to talk about pulmonary hypertension or what have you. And then afterwards he'd say, you guys want to see a card trick? And I just thought that was amazing. And I had never been exposed to that sort of in real life, just someone doing tricks like that. So after that, fortuitously for me, my very next rotation was pediatrics. And so it just kind of clicked. I really enjoyed that. Maybe I should learn a few things. It might help while I'm on the rotation. And boy, I had no idea it would get me into some of the things I'm in now.
Well, how did you learn magic? How do you learn it?
Well, I actually went to Dr. Webb and asked him that question. I was like, where do you learn this? And books, for one. Some of the best ways to learn are actually still just books. But nowadays, obviously, there are many, many different avenues for video and things like that. What I think is fascinating comparing magic to medicine is that we kind of do the same thing. There are books, there are lectures, there are conferences. There's everything you can think of in the field of medicine. They do the same thing in magic.
How do you combine the two?
In many ways. Now, the obvious way, obviously, is to be performing for patients. I think that's what most people think of when we talk medicine and magic. And unfortunately for me, I can't really do that at this point in my career. My patients don't respond too well to that. So I have
anything else.
Right. So I have to use it in different ways. And oftentimes what we discuss, and I even discuss this with my forensic fellows and now residents, things like that, is just using those same skill sets, basically stagecraft, to either interact with patients or, in my case, interact with jurors or anything like that. So it's the idea of how do you present yourself, how do you communicate, do you make good eye contact, and just kind of making either the patient or the jury sort of feel comfortable and sort of that they're there in that space with you and they understand where you are.
What's your favorite trick?
Oh, Lord. Mostly what I do is card tricks, things like that, things that I can carry in my pocket and just, add a notice if I need to.
I noticed you came with a full deck.
Well, I don't know. My wife says I play with a partial deck. I don't know. But I do really enjoy that. I guess as far as magic that I can see and enjoy, I love comedy magic. There are several out in Las Vegas, some guys who are just phenomenal. But what I love about them is oftentimes the magic isn't necessarily that technical. It's the presentation. It's how they deliver it that just makes it so perfect.
And what's your favorite audience?
Good question. I love performing for kids, but I will say at a professional magician level, I don't think I could do that. I have such a high respect for kid magicians because they have to have, I guess my kids would say, I don't have that kind of patience. I don't know. I love like the impromptu interaction. So I love performing for children just as you walk by and you're on the street or in the lobby or what have you. But I guess my best performance as far as audiences go, I enjoy performing for other professionals. So for instance, and that goes down to like a teaching level, is I love to perform exactly how I learned right after a lecture. So even now, I'll work with the residents and then afterwards say, if we got a few more minutes, let's do this.
You want to see a card trick?
Yeah, exactly.
I'm thinking here on the Mayo campus, the Gonda lobby has got that beautiful piano. I just liked you throwing down a couple of card tricks right there in the Gonda lobby.
Don't think I haven't suggested that already, so we'll see what happens.
Excellent.
You don't have to. It takes several committees to give the okay for that.
Exactly.
All right, Dr. Reade Quinton, forensic pathologist and a magician.
Yes.
There you go.
The art of magic has a lot to do with the art of medicine, as we've learned. Thanks for joining us, Dr. Quinton. Good to have you.
Thank you for having me.